everyone, my name is Mark Ray. Today I'll be delivering my presentation which demonstrates my understanding of psychological disorder, phobia. The hallmark of phobia, a subtype of anxiety disorders, is excessive and illogical fear of particular things, circumstance or activities. Ad et al. 2019. These anxiety may cause strong emotional and physical reactions, which frequently result in avoidance of behavior and impairment of everyday functioning. In addition, to shed light on the complex interaction between psychological, social, and biological aspects, research into phobia also offers insight into the difficulties in coming up with successful therapies. This presentation will explore the complex nature of phobias and how they are treated, as well as the physical, psychological, social, and biological factors that contribute to their emergence. It will also critically examine the challenges involved in determining the efficacy of phobia treatments. Behavioral condition. The behavioral, cognitive, and psychodynamic explanations are only a few of the social vantage points that can be used to understand phobia. Trappi et al. 2020. It is important to recognize the role that social conditioning and cultural influences have in the emergence of phobias. Genetic predispositioning and neurotransmitter imbalances are biological factors that make some people more susceptible to phobic reactions. Rezain et al. 2020. Due to the subjective character of fear experiences, the variety of phobic stimuli, and the long-term sustainability of treatment outcomes, evaluating the effectiveness of these treatments is difficult. Jin and Young, 2021. By looking into these aspects, it will help to understand phobias and the effectiveness of treatment options, thereby enhancing the quality of life for those who are dealing with these disorders. Psychological, sociological, and biological explanation of phobias. There are 7 anxiety disorders: post-traumatic stress disorder, compulsive stress disorder, separation anxiety disorder, generalized anxiety disorder, panic disorder, social anxiety disorder, and phobias. One of the most common types of anxiety disorders are phobias, which are defined by intense illogical fears that cause sufferers to avoid particular things, situations, and activities. Beyond regular worries, some fears cause severe distress and interfere with daily life. Specific phobias such as fear of heights, social phobias such as fear of public speaking, and agoraphobia are examples of common phobia kinds. Fear of open space. Meleb et al. 2020. Phobia has a significant negative effect on people's quality of life, ability to pursue their education and professional goals, and ability to communicate with others. Emery et al. 2020. Although prevalence rates for different phobias kinds vary, phobias collectively have a significant impact on the community. Friesta et al. 2021. While certain phobias may emerge in childhood, others may surface in adulthood as a result of upsetting events or thought association. The underlying mechanism of phobias are sophisticated interplays, psychological, social, and biological elements. They are complex and multifaceted. Phobias frequently originate from classical conditioning, in which a neutral stimulus is connected to a traumatic event and causes a dread reaction. Carnizzi and Tierney, 2022. Their development is also aided by observational learning and the passing on of phobias within familiar or cultural contexts. Phobia typically co-occur with other mental health conditions, including depression and substance misuses. Their significance goes beyond their immediate emotional impact. Engel et al. 2019. Additionally, distress phobias might lead people to engage in avoidance behaviors, thereby feeding their anxieties and extending the anxiety cycle. The fact that phobias are so common highlights the significance of comprehending their underlying mechanism and looking into efficient treatments option. Choi et al. 2020. It can build the framework for well-informed interventions that lessens the burden of phobia and improve people's well-being. By analyzing the complex interplays of psychological, social, and biological components, psychological explanation for phobia as a psychological perspective, clearly how certain cognitive and behavioral processes contribute to the genesis and persistence of these strong and irrational anxieties. Psychological perspective shed vital light on the causes and progression of phobias. Behavioral perspective. The behavioral perspective holds that phobia developed through classical conditioning, a process in which a neutral stimulus is connected to a painful event, producing a conditioned fear response. Ad et al. 2019. An illustration someone who goes through traumatic event that involves an elevator could later develop a phobic fear of elevators. Additional operant training contributes to the maintenance of phobias. The avoidance of response is reinforced and phobia is sustained through avoidance behaviors such as crossing the street to avoid the dog. Trapi et al. 2020. Cognitive perspective. According to the cognitive approach, flawed mental process and illogical beliefs plays a significant part in phobic reaction. Jin and Young, 2021. People who have phobia sometimes overestimate the likelihood and severity of events and catastrophic perspective hazards. Rezain et al. 2020. These mental distortions support anxiety and help keep phobias alive. Additional, people may adopt safety practices to keep them from contradicting their frightening beliefs, such as carrying particular objects to manage anxiety. Psychodynamic perspective. The psychodynamic viewpoint dives into repressed feelings and unconscious conflicts as causes of phobic symptoms. Jin and Young, 2021. It is possible to interpret phobia as symbolic representation of more profound issues. For instance, a person who develops a fear of flying may be unintentionally expressing unresolved anxiety about vulnerability or control. Fiestas et al. 2021. Psychotherapy that focuses on these underlying issues can help phobia's symptoms go away. Social explanation for phobias. Phobias are highly influenced by social variables, emphasizing the importance of social learning and cultural influences on the development and maintenance of these extreme and irrational anxieties. Choi et al. 2020. Observational learning. Observational learning is a significant social mechanism involving phobia development. People develop their phobia through seeing other people's scared behavior. Hayhad et al. 2019. This may be especially obvious in young children who take on their parent or caretakers' anxieties. For instance, a youngster is more likely or culturally grouping et al. Or to develop phobia of spiders if they see their parents exhibiting great fear for them. Hayhad et al. 2019. Social learning theory. Transmitting within cultural groups, phobia can be passed down through social or cultural groupings. Hayhad et al. 2019. The kinds of phobias they may be developed are influenced by social expectation and cultural standards. For instance, social phobias associated with public speaking or scrutiny can be more common in culture that sets high value on performance and appearance in public. These anxiety may be reinforced by shared cultural narratives and experiences, increasing the likelihood that they will be acquired and sustained. Trappi et al. 2020. Media and social influences. The propagation of phobias is aided by the media and social media. Razain et al. 2020. Online debate moves and news articles can spread concerning and amplify anxiety despite the statistically low possibility of such an occurrence. Someone who watches a news broadcast and shark attack might develop an irrational dread of swimming in the ocean. Jin and Young 2021. Biological explanation of phobia. The formation and maintenance of these powerful unreasonable anxieties are influenced by biological factors, including genetic predispositioning and neurotransmitter imbalances. Choi et al. 2020. Genetic predisposition. According to the research, the onset of phobia may have a hereditary component. People who have anxiety disorder, including phobias in their families, are more likely to experience the same phobia themselves. Choi et al. 2020. The genetic foundation of phobia has been highlighted by the identification of particular gene associated with the higher incidence of anxiety disorders. Hayhad et al. 2019. Neurotransmitter imbalance. Phobia are a result of imbalance in neurotransmitters, which are the chemical messengers that carry impulses throughout the brain. Gemma anomeboitric acid, GABA. A serotonin dysregulation have been regulated to increase anxiety and a propensity for phobias. Engel et al. 2019. Unbalance in these neurotransmitters, which govern anxiety and fear responses, may cause higher heightened fear responses to phobic stimuli. Carnese and Terreni, 2022. Brain structure and function. According to the brain imagining research, those who have phobias have different brain structures and functionings. Ayad et al. 2019. People with phobia frequently have hyperactivity in the amygdala, a crucial brain area involved in processing fear, which causes exaggerated fear reactions. Emery et al. 2020. Additionally, individuals with phobias may display abnormal connection in the prefrontal cortex, which is in charge of controlling emotions. Okay. Treatment for phobias. A variety of treatment modalities that target the psychological, emotional, and behavioral aspect of these strong and unreasonable anxieties are used to manage and lessen the uncomfortable effects of phobias. Razain et al. 2020. Psychotherapy. Phobia are typically treated with psychotherapy, with cognitive behavioral therapy, serving as the cornerstone. Mal, Lee, Bell et al. 2020. In order to help people face and manage their fears, exposure therapy, a form of CBT, gradually exposes people to the feared stimulus in a safe atmosphere. Over time, this technique helps with this desensitization and lowers anxiety reaction. The cognition structuring techniques used in CBT assist people reframe their thoughts and behaviors in response to frightening stimuli by focusing on the irrational thought process that underlie phobias. Engel et al. 2019. Medication. If phobia symptoms are severe or significantly interfered with daily functioning, medication may be administered to treat those. Trappi et al. 2020. To lessen anxiety and fear responses, people frequently utilize benzodiazepine and selective restoraatin reuptake inhibitors SSRIs, but when used in conjunction with psychotherapy, which address both the biological and psychological elements of phobias, drugs are frequently more effective. Aad et al. 2019. Self-help strategies. Self-help techniques enable people to actively participate in managing their fears. Free et al. 2021. People can manage their anxiety in the present by using methods like progressive muscle relaxation, deep breathing, and mindfulness. Systematic desensitization is the gradual, controlled exposure of frightening events and can be undertaken on one's own or under direction of self-help materials. Trappi et al. 2020. Assessing the effectiveness of phobia treatment. Due to the complex nature of fear responses, individual heterogeneity, and the long-term sustainability of treatment outcomes, evaluating the effectiveness of phobia treatments presents special obstacles. Free Estes et al. 2021. A thorough strategy that takes into account both subjective and objective markers is necessary to accurately argue the decline in strong and illogical concerns. Engel et al. 2019. Challenges in treatment assessment. The subjective nature of dread experience makes determining therapy effectiveness one of the main obstacles. It might be challenging to determine progression since people might underestimate or exaggerate their degree of dread. Additionally, cognitive and emotional elements that can differ from person to person are also affect how one reacts to fear. Melly Ebb et al. 2020. Although they can yield useful information, objective metrics like heart rate or skin conductance may not fully reflect a person's experience. Trappi et al. 2020. Outcome measures. Despite these difficulties, a number of outcome measures are frequently employed to evaluate the efficacy of phobia treatment. Self-report surveys such as fear questionnaire are used to gauge the severity and phobic symptoms and how they have changed over time. Hayhad et al. Behavioral observations made during exposure therapy sessions can reveal information about a person's capacity to face and control their fears. Jin Young 2021. Functional evaluation also show the treatment's wider effects beyond fear reduction, such as increase in everyday functioning and quality of life. Long-term success evaluation of the long-term efficacy of phobia treatment is crucial. Fear reduction that lasts only a short while might not lead to a long-lasting gain. Carneazzi and Tereni, 2022. Assessment made methods or even years following treatment can show how long-lasting benefit of the treatment were, determining if people continue to make a development and can handle terrifying situation. Choi et al. 2020. In conclusion, the study of phobia and how they are treated highlight the complexity interplay of psychological, social, and biological elements in the emergence of these extreme and unfounded anxieties. Psychological explanations shed light on the unconscious process, cognitive biases, and thought association that influence phobic reactions. The development and maintenance of phobias are influenced by social variables, such as cultural influences and observational learning. The connection between genetics and brain function is highlighted by biological factors including neurotransmitter imbalance and genetic predispositioning. Effective treatment includes psychotherapy, drugs, and self-help techniques with an emphasis on all-encompassing tactics customized with each patient's needs. However, given the subjective nature of fear experience and the intricacy of long-term effect, determining treatment success is still difficult. Clinicians and researchers can develop our capacity to lessen the burden of these diseases and enhance people's well-being through a holistic understanding of phobias and rigorous assessment. I now open the floor for questioning. Thank you.